Okay, welcome back to Eterna MD. Actually, today we're doing a follow-up, and actually the treatment that we're going to be talking about today is about how to treat keloids. So those scars that actually are pretty big, and really many people don't know how to approach it. It's actually very common in people with skin type 6 or darker skin, some genetic predisposition on it. Actually what it's causing these days is a problem with the appearance of the skin. So I just want to let you know, tell us here honestly, what, after you start coming here, how many treatments you have received and how have been your experience and outcome too.
Okay, first of all, we have a great doctor, Dr. Mercado, has been treating me since April of this year. And let me tell you about my scar first. I went to the beach one day and I was bitten on the chest, and it started out as a small pimple, and then it grew up to a big scar, and I was really disappointed about that. And I had a scar removal because it grew up to a keloid, really big. And if I had known about Dr. Mercado and his treatment about carboxytherapy, I would have come to him first. And after a few treatments, I'm really satisfied with the way the scar has gone down and it's really flattened out. And what I didn't like was the fact that it was really bulky, and it was also itchy. And for people who like to go to the beach or who are very active and like outdoor activities, it's really disgusting. So that's why I came to see him. I found his information over the internet and I did a little bit of research, and I looked up the information, and I knew that they had training in France and in the United States with very respective clinics. So that's why I picked him, and I came over. And today I'm very happy with the progress of the scar, the way it's been going.
Okay. Actually, what he's getting is actually something called a carboxy therapy, which is actually injection of a CO2. Actually, it's a scar is located here on his chest, and later we're going to show it, the improvement. We got some pictures also we're going to show on the video, so you can see the progression of the disease. But part of the treatment that actually have been receiving something called carboxy therapy, which actually I taught to you guys, I believe, in a different video. I went through a blackboard and explained everything, how it works. But I use carboxy therapy actually to improve circulation, improve oxygenation into the tissues. And then, on his case, actually we did a little bit of solution called KELOIDS, which is basically a potent anti-inflammatory. So how many treatments have you received so far?
About 6 treatments.
6 treatments, right? Again, there have been no surgical. We didn't have to take any knife and cut it out, because sometimes if you cut it out, these keloids actually can tend to grow back even more, because this is something from the inside, from the genetics. So in his case, actually was very successful using the combination treatment approach, using carboxy therapy as well as a little bit of anti-inflammatory. I'm going to put the video on stop right now.